Now at 5:30, fighting back another surge as Ohio braces for the winter. Coronavirus cases are back on the rise.
And with the holidays coming, that is a bad sign. Here's why. In the last 24 hours, more than 5,600 coronavirus cases have been reported in Ohio. Hospitalizations have skyrocketed, almost 460 in one day alone.
On the vaccine front, almost 12,000 people started their shots, but that's still only around 57% of the state's population, which according to the New York Times leaves Ohio the 10th least vaccinated state. The best, Massachusetts at 83%, the worst, West Virginia at 49%. So the question is, what does all of this mean for you?
That's what people are wondering. Well, Jade Jarvis begins our in-depth coverage. Jade, you spoke with local doctors and they are worried.
Yeah, that's right, guys. Well, experts say at this stage in the pandemic, the coronavirus will take advantage of any perfect storm it's given. Right now, that consists of the cold and flu season, the Delta variant, and Ohio's low vaccination rate.
The frustration is palpable because at this point, we know so much about this virus.
And yet the coronavirus is surging throughout Ohio. The Ohio Department of Health reporting nearly 4,000 new cases Monday and a spike in hospitalizations up to 2,700 from 2,200 earlier this month. Dr. Mark Cameron, an immunologist at Case Western Reserve University, says our state isn't alone. 81% of Vermont's residents have received at least one dose of the vaccine, and cases are surging there too. Ohio's numbers are much lower at just 57%, which Cameron says puts us in a unique position.
What it means is there are a lot of towns and counties and people in the state that the virus can reach.
And as we enter the holiday season, he says there are more chances to expose each other to the virus if more people don't get vaccinated.
And you're going to feel a poke.
That really has to hit home with us at this point, that we are putting ourselves at risk for a repeat of 1 year ago, the hospitalization, the sicknesses, and the deaths.
Doctors here in Northeast Ohio say they're already seeing that firsthand.
We've seen an upswing of cases in the main campus of UH in the last week or so, 2 or 3 admissions a day.
Dr. Keith Armitage, the medical director of the Roe Green Center for Travel Medicine and Global Health at University Hospitals, says he thinks it's unlikely we'll see a critical surge here because of vaccination rates being on the higher end locally.
But with the Delta variant, we probably need over 90% to really slow this down.
You're going to clean your arm.
Despite kids between the ages of 5 and 11 now being eligible for vaccinations, Armitage doesn't think it will help us get there because many parents are still hesitant.
All right, you're all done.
And without a boost to those numbers, he believes COVID-19 will be a part of our lives for much longer than we'd like.
It's really unfortunate. It's part of this whole pandemic. It's become kind of part of the political fabric and people are dug in their opinions. And I just would recommend people look at the science.
Now, Dr. Armitage is encouraging anyone who is eligible to get their COVID-19 booster shots to do so, especially those in high-risk groups. It takes about 10 to 14 days to kick in, so it might be a little too late for Thanksgiving, Homa, but you should be in good shape for the rest of the holiday season.
Jade, when he said it could be a repeat of last year, nobody wants that. Thanksgiving is a little over a week away. So what did the doctor say? Should unvaccinated family members really gather this year?
Well, he says it's not a one-size-fits-all situation. So if you're low risk and unvaccinated, be cautious. But if you're older and if you have underlying health conditions and if you're unvaccinated, he says you probably shouldn't be going to large indoor family gatherings at all. It puts you at greater risk of going to the ICU, being put on a ventilator, or even worse.
All good info. Thank you so much, Jade. We appreciate you.